Welcome back to the Physio Foundations podcast for another week. So this week on Physio Foundations is part 2 of my conversation with physiotherapist, triathlete and physio educator, Dr. Sarah Ward. And this week we're going to go into the physio education side of things. We've talked about clinical practice and the journey towards research and informing research with clinical experience with Sarah last episode, not last year. And now we're going to talk about physio education. So, Sarah, welcome back to Physio Foundations Reload, part 2, round 2.
Excellent. Thank you for having me back.
So let's pick up where we left off. So in the last episode, we were talking about your journey, transition, the way you really developed a career from the day you graduated undergraduate physiotherapy and how you got into your PhD. And then my last question was, so how do you apply everything you learned in your PhD to clinical practice? Let's ask that same question. How do you apply what you've learned so far in your career to your teaching? And in fact, before you answer that, tell us about your teaching. So where are you a physio educator?
Oh, that's probably the most sensible place to start.
Yes, let's go back a step.
I am at currently the University of Auckland, which is in New Zealand. Your Eastern Isle, depending on the joke that you run. It's a new program. We just started it this year. So we're not a traditional physiotherapy school in New Zealand. In fact, we're not actually a physiotherapy school. We're housed within the Department of Exercise Sciences. So we sit alongside the Master of Clinical Exercise Physiology. And our program is called the Master of Physiotherapy Practice, and it's the first graduate entry masters for physiotherapy in New Zealand.
So you've done undergrad yourself, and then you're teaching into the newer model, the grad entry with exercise science, and you've got an exercise science background in your master's and PhD. So, yeah, that suits you.
It does, and the most hilarious part is actually when I did my postgrad diploma. I actually did it in the department I'm now teaching in. So there's some good familiar faces.
You've been around the world, literally.
Yes,
you're back into that.
Literally, when we spoke about coming full circle in terms of clinical practice last time, we've now come full circle in terms of geographic location as well.
What about, that's so good. What about a bit of an overview? You started on talking about the differences between undergrad and the postgrad model. So that's the first in New Zealand, first grad entry physio course. What other courses are there?
Traditionally for us, it's the Bachelor of Physiotherapy at Otago or the Bachelor of Health Science in Physiotherapy through AUT University, which is just on the north shore of Auckland.
Okay.
For a long time, that was the only 2 physio schools in the country, both 4-year programs. And then in 2018, I might get it wrong, Wintec down in Hamilton started their Bachelor of Physiotherapy program, because we had a massive need for physiotherapists in New Zealand.
That was driven by workforce need.
Yeah, but also developing physiotherapists for the community that they are in as well. So rural communities, Maori and Pacifica communities is really important, particularly through the Waikato. And so they've just graduated their first cohort through that program. And then, it's still an in-demand profession here, but we've also got grads coming out of sports science and biomedical science and health science programs. And we want to be physios because this is the situation I was in. And you're only faced with an option of going back and doing another bachelor's degree. So another 3 or 4 years at university, which is a substantial cost. So we followed the Australian model and brought in the first graduate entry program. So for us here at the University of Auckland, it's a 2-year program. Very full on, with slightly longer semesters to try and account for the condensed content.
Not the trimester model, but long semesters.
Yeah, long semesters. They're about 13 to 14 weeks, so a few extra weeks tacked onto each semester. And then if you imagine your undergraduate curriculum and you rip out the physiology, like the basic physiology, the basic anatomy, the basic neuroanatomy, et cetera, and whatever you're left with, the physio-specific stuff, that's what's left in a GEM program.
So despite taking things out and having prerequisites and assumed knowledge, it doesn't mean you can recall that anatomy off the top of your head when you go to apply it, does it? And on top of that, you're very busy when you're in
Exactly. And, these students did anatomy in their first year of their undergraduate program when this program didn't exist. So there's no reason or incentive to retain that knowledge. So that was a very quick learning for me of, okay, I can't assume that people have retained the knowledge. Yes, they've got the prerequisite, but they haven't retained it. So it's embedding or re-embedding that those key, functional anatomy or pathoanatomy into the lectures as well, or guiding them through revision rather than just saying, yeah, have an entire anatomy curriculum revised.
It's the perfect opportunity to go straight for the jugular for my main question, the main question of this podcast.
Fire away.
I always ask. So then, and this is particularly relevant if you've got a shorter course and you go for those physio-specific skills and knowledge. So what, in your opinion, with your biases and your background and everything you do, what are the most important foundational skills and knowledge for a physio that you can't go to work without? And this is always gets a laugh because it's such a broad question. You could answer it any way you want.
Anatomy knowledge.
You're talking to my biases.
Oh,
that's why. Why is anatomy knowledge so important?
I think if you don't know the human body, the diagnostic part becomes really hard because you've got nothing to relate it back to. What actually, maybe we call it the pathoanatomy. So what actually happens when you tear a ligament? What actually happens when you have a stroke? What's the anatomical consequence, but what's maybe the physiological consequence too? And so actually having that foundational knowledge, but then integrating it properly into the more physio-specific stuff. So then layering the context on appropriately, I think is probably, that's my big learning from this year around, I could give you, communication's really important. Empathy is really important. But if you don't have that knowledge, doesn't matter how empathetic you are.
Foundational knowledge. Tell me more about anatomy. So pathoanatomy you mentioned. So the intersection between pathology, anatomy, applied anatomy. Yeah. So applying physiology and applying to all your clinical tests and skills and diagnoses and imaging and everything, having that foundation of anatomy as a foundation. Foundation of anatomy as a foundation. I ran out of things to say.
For the lack of a better way, I don't think there's a better way to put it. To be fair, I just think it's literally the foundation of our profession. There we go. I feel like we can have a bingo on this of how many times can Sarah and Luke say foundation in a single conversation.
We'll just keep going.
Yeah.
So tell me, let's go and talk about experiences now. So that's our ideals and the things we value. And I guess your teaching philosophy comes from your background and your big focus on anatomy. And of course, you teach other aspects of the units in the course.
Yeah.
So the last couple of years were really disrupted in Australia by COVID-19 pandemic-related lockdowns, and we had more. I guess you had border closures for New Zealand. We had lots of population level lockdowns. You're locked in a sort of radius of 5 kilometres at times. It's very disruptive. So it disrupted everyone, including education. Lots of things went online for a certain period. What was it like in New Zealand over the ditch?
Oh, so it's been an experience. I would say your experiences would depend on what part of New Zealand you were in. So when COVID first landed in New Zealand, I was actually in the South Island, back at Otago as a researcher. So we went through the initial 2020 lockdown, the 7-week one sort of through March through to June 2020. And so our reaction there was to just push all the clinical and practical learning into semester 2 and just cover all the theoretical stuff for our second and third year undergrad students. For our fourth years who were on placement, they learned telehealth. So they were still able to get some clinical hours in the School of Physio clinics, so delivering telehealth.
Was there more telehealth than they would have? Well, I guess that's a yes, isn't there? Because they did more of it. But was that a good thing, I guess is what I'm asking. Was there benefits there that perhaps it was unexpected, unwanted at the time, but
I think
telehealth is a really important thing for people in rural and remote areas, for example.
Yeah, I think it's always been bubbling away, right? But we never had that impetus to really bring it to the forefront in physio. And it really just forced our hand and go, okay, right, it's now or never. And so everyone's had to use it at some point in the last 2 or 3 years. But I think it's given options now so that your patients in the South Island can now access the specialists in Auckland or the specialists in Wellington or Christchurch without having to physically go see them. I experienced that myself as a patient of being able to have a Zoom conversation with specialists in Auckland or Queenstown from home in Dunedin, which was phenomenal because it saved, a 2-hour flight or a 3-hour drive to go see them. So I think it's been a really good progress for the profession, but also a really good experience for the students to have something a bit different. The Auckland students, very different kettle of fish because Auckland has been sort of the epicenter for COVID in New Zealand through the last 3 years. So it's been most disruptive for Auckland-based university students across the universities. This year has had unique challenges, I would say, because the New Zealand approach changed slightly. So we had a risk assessment, and that we decided based on the last 2 years of experience that it was really important to have those clinical sessions, so the labs, where you learn your clinical skills as face-to-face sessions. Trying to teach that stuff over Zoom, really freaking difficult. Lectures, fine. Cover the theoretical content in the lectures in Zoom lectures, minimize the risk so that you could have those face-to-face sessions. We created clinical bubbles with our students. So they would form groups of 3, and that was only 3 individuals they could interact with for most of the semester.
Back in 2020, we're talking about in the peak of the...
this was this year as well.
This year.
Yeah, so that was our strategy this year in Auckland. Clinical bubbles, masks they had in terms of equipment. Obviously, we share equipment a lot, right? In lab, we created a box of all the necessary equipment, including hand sanitizer and towels and everything for that group. And it was labeled so no one else touched it. It was really hard as an educator because going back to the philosophies, I circulate, and you linger and you interact with the group. You
also encourage students to do that and see work with as many different people as possible for many reasons. Yeah.
Right. You interact with different body shapes and the different genders because it feels different, right? And so that was taken away from us because for risk reasons, it was part of our risk plan to not circulate between the groups. So it was like, well, how do you demonstrate a skill to the class for them to then learn and practice in those groups? And that was really hard. And I still don't think I got it right in that first semester. But I think we're all sort of learning as we went.
But you've hit on a few interesting points there because we talked about the disruptions and it being a overall negative thing of disruption, but having the not necessarily just always being in a group of 3, but being more strict with hand washing, hygiene, really reflecting what's happening, the realities of what's happening in the health services, because we could have a big open forum and everything's open. We're pretending there's no pandemic the whole time outside of a hospital, and in the hospital, it's chaos. The health systems are under enormous stress and students are going to go into that system as well. So having it reflects realities a little bit, at least. Do you do any simulation with your students? I talked to Narelle Dalwood on the podcast, that must be 6 months ago now, about the simulation program. Do you do anything like similar to that?
We're trying to set one up.
Cool.
We literally had the emails flying today about sort of what we want in that space to create at least a hospital simulation space. We've got the space within the department to already recreate sort of a private practice musculoskeletal simulations, which is essentially how I teach that element of it anyway. But to be able to create hospital simulations, I think is our next plan to introduce next year.
It's good for clinical educators and clinicians and people in general, future students even, to sort of hear us talking about this stuff. It's not a secret what we're doing there. It's not some secret society of academia in the ivory tower. We're just normal people working our butts off and trying to give the best possible education, sometimes under really difficult circumstances.
Yeah. And you've literally just summed up the way I teach, is that I just try and normalize it. I'm like, I make mistakes. I might have different clinical reasoning to you based on different experiences, right? And just try to make the learning relatable to them. So that to try and keep that engagement, because I think if we think about the disruptions and how difficult it's been, student engagement has been real hard, particularly on Zoom.
It's hard. It's actually, we don't want to pick on students, because you go to a faculty meeting or you get something outside the university and you'll go in there with professionals, and there's a lot of cameras that are turned off, and it's hard to engage. And I know people work on their own work on Zoom and everything. Hey, it's got its benefits. There's sometimes you might input to something and you might be able to do two things at once, and you might save yourself an hour of driving to a meeting that you just needed to input into for 5 minutes. I get that, but to sit there for 2 hours on something that's an online tutorial, I get it. I
got sick of my own voice.
And when you talk to people, it's just really hard to talk to a group of people and the camera's off, fine, but also no one wants to unmute and talk, especially when you're young.
Yeah, and it changes the way I taught as well. Like I'm a wanderer, even in a seminar. You engage and you try to create engagement opportunities, but that totally changes on Zoom, where you yourself are sitting, and it just creates less opportunities for engagement, but like casual engagement rather than you like calling out a student, which I know as a student terrifies me. Like, I don't like operating like that, and I found certainly it became more didactic learning too.
It's different.
Bring that knowledge to you, whereas I think physio can certainly lend itself to some really cool, different learning opportunities. But it was difficult with COVID. But hopefully we can move more into those in the next few years, and at least show our students that it can be a really cool learning experience, and that learning can be fun and engaging again.
Yeah, keep the good bits of the online learning and whatever has to be done face to face, make sure that happens in the safest way.
People will still have injuries where they can't physically attend class. So I think it's been good to give us that sort of swift kick up to go, actually, we do need to be more accessible for students that can't make it into class, but we also need to make sure that we're meeting the requirements of our profession as well, and building those clinical competencies, which really is best done face to face.
You see, everyone, we do think about what we're doing and why we're doing it, and we do care.
Yeah, we do. We have the students at the forefront of certainly our planning, and that we're really trying. It's just we're hamstrung as well at certain points, right?
One of the many reasons for doing this podcast for me is just communication, connection between different camps of people, artificially separated. For example, students, educators, clinical educators, clinicians, and researchers. Look at you. This is the whole point. You do all of that stuff.
Yep.
You studying anything as well, or you're done? You've reached PhD. That was your retirement plan. You said in the first episode. Yeah.
I might be studying again. Yeah. During 2020 and 2021, my own research was so disrupted by COVID, because no winter sport meant no knee injuries, which meant no elective surgery. And no ACL patients to study. So I was like, well, how can I change my research to fit this? So I started studying applied statistics.
Yeah, well, you'll be very popular.
I love it. And so it gives me opportunities to basically pandemic proof my research, but also ensure that my research is moving as the profession moves into sort of more data-driven approaches. And then I started dabbling in a little bit of sort of post-professional specialization as I went back into the clinic. I was like, well, let's just make sure that my clinical skills are also moving, particularly if I'm educating, right?
Yeah, that's it. You're not just some stale academic who trained 30 years ago, as this stereotype goes. Hey, the people I know who work in academia who trained 30 years ago are just brilliant. They're doing so many ongoing education. Don't really know anyone that fits that stereotype, but
no, not in physio. I think most people recognize it's a really dynamic profession and engage in learning opportunities to upskill. But it was probably the biggest thing I touched on in my interview with Auckland last year, was that I think to be a good clinical educator or a good physiotherapy educator, I think you need to be a good physiotherapist. And I think to avoid that apparent staleness is to practice what you preach.
And at the same time, though, being an educator is being a really good clinician doesn't make you a good educator. So you've to be continually training in education skills, working with people like Mick Storr, who I work with, and others who have got masters of education as well as PhDs, and they teach you so much about the skills of educating. So it's ask a school teacher. They've done a master's to do that. It's a skill.
Oh, absolutely. Just because we have a PhD, it doesn't actually mean we're trained in adult pedagogy, right? We don't get taught how to teach. You kind of just follow along mentors, or you take bits and pieces from what's made a good educator or what was a good experience for me as a student, and pick that bit, and then you pick that bit from someone else, and you try and mold it into something like a Frankenstein and hopefully that Frankenstein works. Yeah,
exactly. You know what time it is? Time to finish. I've got to pick up the kids. We're going to let's catch up again. Let's do it again.
Oh yeah, I feel like we've got a lot to unpack.
Yeah, exactly. I say that because I feel like we've got about 3 or 4 different episodes we could do right now. We can't though, because we've got things to do, and you've got a triathlon to go and rest up and do tomorrow. Good luck with that.
Thank you.
Get on Twitter. You can follow Sarah and you can see how she goes. And I'll put all the I'll put your Twitter handle in the show notes, and as well as some information about you. But thank you very much for 2 episodes there. That's a really interesting conversation. It's really so good to catch up with you again and hear what you've been up to and get your perspectives on New Zealand physiotherapy education and your research. So good.
Thank you. Thank you for having me. It's been a great conversation. And if anybody wants to reach out, have a discussion about New Zealand physio or just knees or triathlon, happy to have a yarn, as you can tell.
All of the above.
Yeah.
Thanks, Sarah. Well, let's leave it there. Luke. So until next time, this is Sarah Ward and Luke Perraton wishing you all the very best with your studying, professional development and lifelong learning.